Hey Perky, what's up, buddy?
Don't know. It's all so dull.
Come on. You are Perky. Perk up.
You think I like to be sad? I just don't feel up to it.
Valid point, mate. So what should we do?
I don't know.
There are days when everything looks dull and dreary. Sometimes there seems to be a reason, and at others, it just seems to come from nowhere. Like a dark cloud, sadness, dullness, hopelessness envelops the whole self. Many of us can snap out of it, but for some of us, the pall of gloom lingers, no matter what we do or what anybody says. Hi, I'm Dr. Jyoti Kapoor, and we are at Manasthali, where mind meets matter, trying to figure out where this pall of gloom comes from and how to lift it up and throw it away. Depression is probably the most abused word in context of mental health. But in the clinical jargon of psychiatry, all that's mental is not depression. It's a term used when someone has persistent symptoms from a set of criteria: persistent sadness, loss of interest or pleasure, fatigue or low energy. Apart from one or all the symptoms mentioned above, lasting most of the time for over 2 weeks, associated criteria like poor sleep, poor concentration, low self-confidence, disturbance in appetite, suicidal thoughts or acts, agitation of or slowing of movements, guilt or self-blame may be present to varying extent. The intensity of depressive episode is generally clinically defined based on the number and duration of symptoms. But for all practical purposes, intensity may fluctuate on day-to-day basis, but the impact is felt and observed most of the time. But why does it happen? We are always seeking happiness and joy. We want to feel good and laugh and play. Being sad can't be a voluntary decision. So when we feel sad, we try to find a reason. We may say it's because no one loves me, no one cares for me, I'm unable to achieve anything in my life, and a number of other reasons. Have you heard the poem about the happy man with no shirt? I had read it in school and looked it up on Google, and after a lot of research, found it. Here is the poem.
Happy Man's Shirt. High on a hilltop, a proud castle stood, by shimmering lakes and the king's own wood. The king felt no joy, and the wise oak court said that his cure was a happy man's shirt. The king went out to wander the land, to find a happy man. But every place he went, all wanted something, none were content. But a whistler, roaming carefree, said the king, "Will you lend your shirt to me?" The whistler laughed, happy to share, but under his coat his chest was bare. The king laughed aloud, his heart serene. With light steps he set off home to his queen.
And here is a philosophical approach to life's big questions. In medical parlance, 1 + 1 is not always equal to 2. Neither our body nor our brain reacts to the environment in the same way all the time or in all circumstances. Thus, we can say that the cause of a problem is multifactorial, or it is due to a number of factors. Disorders like depressive disorders can occur due to external factors, and we call them exogenous, or due to no apparent cause, and then we call it endogenous depression. But neither exogenous or reactive depression is only because of the external or environmental factors, or endogenous depression purely without any external implications. In other words, depressive disorders occur due to interaction between internal factors like our genes and our physiological vulnerabilities and the environment that influences us on a regular basis in our family, neighborhood, school, society, and even the world. When so many factors are at play, treatment thus focuses on individual person rather than the individual external factors. Like I searched for this poem on Google with just a few keywords that I remembered from my 6th grade. Many times we go the Google way to search for what's happening to us. And then we go to the doctor and say,
I have depression.
Oftentimes, I tell my clients that if you do my job, why pay me? But of course, we like to find stuff out for ourselves, self-diagnose the problem, be it our microwave or our body. But just knowing that my microwave's magnetron failed doesn't help us to repair it, does it? Similarly, a diagnosis is just the first step in dealing with the problem. That doesn't mean that it is not important. It's probably the most important step, because if we keep trying to treat depressive symptoms of a person suffering from another clinical illness, say bipolar disorder, we may end up doing more harm than good. So, we may Google symptoms, but the smart thing will be to let your psychiatrist do the job. If for nothing else, you can still blame him or her later. How does one treat depression?
There's no change, doctor. I still don't feel like doing anything.
Okay, did you take the medicine?
That's the thing, doctor. I don't even feel like taking medicines.
Treatment of depressive disorders is probably the trickiest part in our profession. Why? Because the symptom of the disorder is a lack of interest in getting better. Effective treatment of a problem depends upon several factors: correct diagnosis, planning treatment according to symptoms, intensity and duration, treatment compliance, addressing side effects if any. But most important part of treatment is psychoeducation. It's hard enough for the depressed individual to seek out help. The greater issue is the people in surroundings who discourage patients to seek help. The stigma aside, there's so many myths that our society has about these ailments, and everyone thinks they are an expert. After all, we are a society who can teach Sachin Tendulkar how to play cricket. Yesterday, a client of mine came to me saying that her husband has been asking her to stop antidepressants. How long are you going to take them? I often say, how long is he going to wear his glasses? After all, since he can see well with them, it should have cured the eyesight by now, right? This discussion is not so much about treatment, but obstacles in treatment. From the family members, friends, well-wishers, chemists, and even doctors, everyone seems to be advising against treatment, while still lamenting over increasing rates of suicide across the world. I hope that this message goes to all those well-wishers, that what are they doing to help patients suffering from mental health issues? Does ignoring a problem make it go away? How does one make a person who is unable to get out of bed in the morning to practice yoga? Is blaming the individual enough? So what are the treatment options? From the clinical perspective of modern psychiatry, treatment is based on correcting the neurochemical imbalance, which lies at the root cause of symptoms. Here I wish to emphasize root cause of symptoms and not the problem, because first step in treatment is always symptomatic. If you come with fever, before I can find out why you have fever, I should bring down the fever, because high fever itself causes a lot of physical issues, from discomfort to seizures. In case of mild to moderate symptoms, we may still start working at the cause of the problem. But if symptoms themselves are causing a hurdle in reaching at the root, we have to focus on the symptoms. Now, many a times people around the world try to discredit the science of treating symptoms as if it's a bad thing. If a disease has already taken its root, the first thing we want is to get rid of the pain, the discomfort, the very symptom that brings us to a doctor. If relief is not provided, one can't go through the process of healing and recovery. So, what are our treatment options? Medicines, psychological interventions, alternative practices, lifestyle modifications. In our next episode, we would look at these treatment modalities more explicitly. For now, I leave you with the thought, what's the one thing that everyone wants? In order to understand how to get what we want, subscribe to our channel, Manasthali, where mind meets matter. See you next time.